So when you're doing an ear wedge, the most important thing would be you've got to get the cancer out. So if it's suitable to do an ear wedge on it, then you've got to plan it. Then you've got to make sure you have an adequate margin put on it and do your drawings, and that's what you're going to cut out. With ear wedges, the problem with ear wedges is it's going to make the ear a lot smaller. So you don't want to have a very large lesion and then end up with a really tiny ear at the end of it that looks so abnormal and deformed that although a lot of patients have their hair over the ear, especially a lot of the oldies, they don't care. You see a lot of oldies when they've been to the plastic surgeon, and some of them, have half their ears missing. So no attempt's been made to preserve the shape of the ear. So there are ways you can minimise what you do with the cupping that you can get with the wedges. You can step the wedge, and depending on whether you step it up or step it down, will give you either a forward-facing ear or a backward-facing ear. When do you determine which way to step it is depending on the natural shape of the ear. If the ear is naturally shaped, cupped forward, you don't want to step it in a way that will actually make that worse. You'd want to step that in a way to open it up, extend it a bit. If it's normally a flat ear that's quite flat and extended out a bit, when you do a wedge on that, you'd rather wedge it so it actually cups it a bit to give it that normal shape. So just by stepping the wedge does probably improve the appearance of the ear.